This evening on South Today, we can exclusively reveal that big changes in hospital care on the Isle of Wight are being planned. St Mary's Hospital is currently in special measures and NHS services on the island are struggling to cope. Proposals include the option of possibly moving more than half of patient services currently provided at St Mary's off the island. It's part of a major overhaul of healthcare across the region. Well, our health correspondent David Fenton is in Newport for us this evening. David, these are radical changes.
They really are, Sally. Big changes that are going to affect tens of thousands of people. The details are due out tomorrow, but I've spoken to people who've seen the plans, and there are a number of options, one of which is do nothing, and one of which is to move more than half of the work currently done at St Mary's over to Southampton. Let me tell you, I don't think either of those options is going to happen, but I think we will see certain patients having to travel more to Southampton to get operations and procedures and appointments.
Well, one's natural tendency is to think that must be worse. Well, who's thinking? Is somebody crazy? If we can do it here, what's the advantage of dragging people across asylum?
Now, travel from the island, of course, is expensive. Eleanor Young had a young child at Southampton General Hospital for 2 months, and she visited every day. It cost her £52 a day to get there and get back. But she says the care was great.
If you're seriously ill, I don't think you get the care here. It's a lovely little hospital, and every time I've been in there, I've had lovely nurses and doctors. I just don't think there's enough of it because there's just so many people, and the island, the hospital's not big.
So I suppose the point is, yes, travel is or can be inconvenient, but is it worth it if you get the best care? Now, of course, that all depends on being able to get off the island in the first place.
The issues are there's only two ways of getting there. One, you can put them in a helicopter, and I can't imagine there'll be much of that because that's not going to lower costs any. The other is you put them in an ambulance and you load them onto a ferry. Well, to be blunt, how many people are going to have to suffer real crises, possibly even death, on a ferry before we realise that this is just not what we can do?
I'm not into political point scoring, I'm not into scaremongering, and I do think that people will be really, really worried by saying lots of people will have to travel. Wherever possible, we'll ensure that we don't have to travel, that we can stay on the island. But if you're going to have the best treatment, we have to remember we are part of the National Health Service. We're not just the Island Health Service, we are the National Health Service.
Now, the island's MP, Bob Seeley, told me tonight that he believes that St Mary's should be working much more closely with those other hospitals on the mainland. The full details are out tomorrow. Radio Solent's going to be having special reports on that. There will, of course, have to be a huge public consultation on all of these options, so nothing is going to happen overnight. It's probably going to take some years.